You like teach all debrief too, right? Physical things.
People on the web can hear you right now. We're just setting up Facebook Live. If you want to probably stand by while we're setting up Facebook Live.
For those on the call, we are in the process of setting up Facebook Live. It'll be just one moment. Everyone on the call, you may see us talking, but you can't hear us. It's because we're on mute. We're waiting on connection to Facebook Live. It'll be just one moment. Thank you guys for your patience. Good afternoon and welcome to day 2 of our 4-part breast health event. I'm Umber Dickerson. I'm the director of the cancer program here at Parkland Hospital. If you missed our part 1, which is called Emotions Tied to Breast Health, be on the lookout on our website. We'll be posting and recording all of our sessions. In today's event, we have 2 clinical professionals who are socially distant, who will be providing you important information about breast health diet and exercise related to breast health. If you have any questions throughout the event, please post your questions on the chat function. And without further ado, let me present today's speakers. Ruchika Sapre. Ruchika has her doctorate in physical therapy from the University of St. Augustine and is a certified wound specialist, certified lymphedema therapist, and completed her certification program in women's health studies from TWU. She has 21 years of experience in acute care and hospital-based outpatient. Ricardo Lopez. Ricardo is a registered dietitian and board-certified specialist in oncology nutrition with more than 7 years of experience. He started his career providing medical nutrition therapy for all types of patients, but now works with patients in the outpatient oncology clinic to optimize the nutrition status to tolerate treatment and help their bodies fight cancer. He also has a master's in healthcare administration from the University of Texas, Rio Grande Valley. Thank you guys, and we're going to kick it off.
Thank you, Amber, for the introductions. As a reminder to all our attendees, if you would please mute yourself. The meeting will be recorded and live streamed on Facebook at Parkland. All comments, questions should be typed into the WebEx chat function, and the questions or comments will be monitored on Facebook. Hello again, everybody. My name is Ruchika Sapre. I'm one of the physical therapists here at Parkland Hospital in Dallas, Texas. On occasion of the Breast Cancer Awareness Month, I will be talking today on the importance of physical fitness in prevention of cancer and also for cancer recurrence. It is very important to adopt a healthy lifestyle for general well-being and for cancer prevention. This includes eating a well-balanced diet. My colleague Ricardo Lopez here, he will be talking shortly on what is a well-balanced diet, how to make your plate, and all the good things we should be eating. Avoiding tobacco use, drinking alcohol in moderation. And what is moderation, someone may ask. CDC guidelines suggest up to 1 drink a day for women and 2 for men. And engaging in regular physical activities and exercises to keep the weight under check and to stay healthy. What is physical activity? Simply put, it is any movement of the body that uses the muscles and more energy than resting. So sitting watching TV doesn't constitute a physical activity. Going from point A to point B from bed to your kitchen to eat doesn't constitute a physical activity in terms of exercise as well. There should be an increase in the heart rate for you to get the benefits of the physical activity and exercise. Why exercise? There are several benefits of daily exercise. Everybody knows exercise helps to keep the weight under check, helps to maintain that ideal BMI of 18.5 to 24.9, which Ricardo will be talking shortly as well. But in addition to keeping the weight under check, it also helps lower the levels of hormones such as estrogen and insulin in the body. And estrogen, as we all know, has been linked to breast cancer. And if we can keep those levels under check, we are already ahead of the game. It helps reduce inflammation and improve the immune system. That's if we can keep our body healthy so that it can fight the outside pathogens rather than what is inside our body, that will also help prevent all diseases and cancer at bay. Prevent weight gain. Obesity is a major risk factor for a lot of cancers. When we exercise, there is an increase in circulation all over our body, including circulation to our gut, to the colon, which will help speed up that digestion process, which may reduce the time that potentially harmful substances are in the colon. It is all the waste products in our body, and they need to be out of our body as soon as it possibly can. And for every day that the bowel movements or bowel contents stay in the colon, our body is going to try and absorb stuff back, and we do not want that absorbed back. Exercise also helps sleep better. We are more relaxed when we exercise, and sleeping is another important factor in the physical fitness, emotional fitness, and I'll be talking briefly about that later. When we exercise, we build muscles. The muscles are going to help boost the metabolism, which is also going to help keep our weight under check. When we have strongly built muscle, any small activity that we do, the muscles are going to be pumping and the fat is going to be burned, so it helps stay healthy and fit. Exercise also helps with the endorphin release. Endorphins are the feel-good hormones, so it helps us feel good about ourselves. It also helps combat some of the symptoms of depression, anxiety. It helps us stay energetic throughout the day, helps us get to do what we need to do to get the day going and feel good all about it. Achieving all of this is going to help reduce the cancer risk. There is a strong evidence that higher levels of physical activity are linked to a lower risk for several types of cancer. There have been several studies that have been carried out, and they found out that for breast cancer, there is a 12 to 21% lower risk of breast cancer in physically active versus inactive women. Women who increase their physical activity after menopause may also have a lower risk of breast cancer than women who do not. And that may have something to do with keeping that weight under check. Excuse me. A lot of women after menopause tend to either build fluid weight or have a weight gain, and when we exercise, we'll get all of those benefits of daily exercise and help keep the weight under check. And let's not forget the estrogen. So the exercise is also going to help balance those hormones, especially when everything is going out of whack. I have listed here the other cancers as well, and the studies that showed the lower risk in individuals who were physically active and who exercise daily. Endometrial cancer, another gene-related cancer, there is a 20% lower risk in highly physically active women than those with low levels of physical activity. Obesity is a strong risk factor for endometrial cancer, and the physical activity reduces that risk for obesity, thereby reducing the risk for the endometrial cancer. I have had a lot of patients ask me, how do you start exercising? I have never exercised ever. A simple way to start exercising is to go on a walking regime, go on a walking program. Today, you may be able to walk 15 minutes. You continue on it tomorrow or the day after, it might be 20 minutes. So you slowly increase your walking schedule, but you have to stay persistent. And it's a good cardio. It is going to help feel better. The weather is good, so you could walk outside, or if you don't feel like you want to go outside, you could walk in your house. But it should be a timed activity and in such a way that you feel that you're building a sweat and you have your heart racing. The recommended exercise guidelines are a blend of cardio and strength training. What is recommended is 150 minutes of moderate cardio per week and or 75 minutes of vigorous exercise. You could stick to 150 minutes of cardio, or you could do 75 minutes of vigorous exercise, or you could do a combination of both. Today I did 15 minutes of moderate cardio, 15 minutes of vigorous exercise. Whatever works for you, whatever your fitness level is, but the key here is you have to get out there and do it. Strength training to build those muscles twice a week is also extremely important because that is going to help build those muscles and help you stay stronger. When we build muscles, we also keep other pains like back pain, hip pain, knee pain away, and that will help you exercise for a longer period of time. Balance training, in addition to aerobic and muscle strengthening, is also very important. Balance training helps to maintain the joint proprioception, the coordination. It also helps get our joint stability. So when we are exercising, if say you're doing vigorous exercise, you won't end up having a sprained ankle or a pain in the knee or a sprained hip. As we are just talking, we are aging, and it's going to we are putting ourselves at a risk for falls eventually if our balance is not right. So it is also going to improve our reaction time when we balance train ourselves. And so say you're outside walking, that reaction time, say you step on a rock or a stone and you are about to fall, but if you have trained your muscles and your balance is good, you may be able to avoid that fall. It also helps with long-term health. A few good examples to participate or exercise techniques is Tai Chi or yoga that is going to help get you that balance training. And yoga also helps with strength training. I have listed here some of the activities that constitute as a moderate physical activity and a vigorous activity. So you may be a beginner, you can start walking and then walking briskly about 3.5 miles per hour. Bicycling, general gardening, just cleaning up the yard, raking leaves, trimming shrubs, that can constitute as a moderate physical activity. Dancing, so exercise can be fun. If you're a dancer, you can exercise and get the benefits of exercising and dancing. Golf, water aerobics, canoeing, or you can grab a partner and play tennis, doubles tennis. You can have a workout buddy who can also keep you motivated. And so you can be, like some days you feel, oh, I don't feel like working out. Your buddy can boost you up, and you can do the same when your buddy feels low. That way you both keep going and you get the benefits of exercise. If you are a pro at exercising, you can start off doing vigorous exercise, but you have to be always cautious when you do any kind of vigorous activities. Running or jogging at 5 miles per hour or more is a vigorous exercise. You could be training for a marathon. That will be a vigorous exercise. Walking very fast, bicycling, heavy gardening, like you could be out in the woods and chopping wood. Swimming, by swimming I mean lap swimming, not the leisure swimming, so going back and forth in the pool, that will be a vigorous exercise. Aerobics and competitive basketball. For aerobics, you could also participate in Zumba. And that is a fun activity. There is music, there is movement, and it's fun, and it will give you that workout. Strength training is also important, and it is not required to have fancy gym equipment or gym membership to strength train. Yes, if you do have free weights or if you have access to them, that will be a good way to strength train. But if you don't have weights, you could fill up a bottle of water at home and use that as weight as resistance to start your strength training regimen. Working out on gym machines, if you have access to that, yoga will use your own body weight and help you strength train and help build the lean muscle. At home, you could do planks, push-ups, squats, abdominal crunches, lunges. All of that will help strengthen and tone your muscles. Muscle strengthening can also be achieved with the use of elastic bands. The resistance that is offered with the elastic bands is a little different than what the free weights offer, and they're both good. There is no advantage of one over the other. So you could do free weights part of the day, the elastic bands part of the day. You could do both at the same time, and that is okay. that will help you tone those muscles. There was a study based out of the University of Sydney back in 2019 in which they studied 80,000 adults and stated that strength training is more effective at prolonging life than cardio workouts. Strength training, they recommended twice a week, reduced the likelihood of dying from cancer by 31%. And combining both strength training and cardio workout had the best outcomes. This particular study did not really show how beneficial cardio workout was on its own, but for a lot of people, they like to start off doing cardio and walking being the best cardio. So when you are exercising, how do you know what is the intensity that you're exercising at? So when you're doing a moderate exercise, and moderate for someone who's never exercised might be different, and someone who is doing a vigorous exercise, it might be different. But a general guideline for moderate exercise is if you're exercising moderately, you can talk, but you cannot sing. And for a vigorous exercise, you may be able to say a few words here and there, but you cannot really hold a conversation. If you want to go really technical and really fancy, you could stick to the metabolic equivalent, or MET as we call it, which is used to characterize the intensity of the physical activity. 1 MET is the energy used when sitting at rest. Like right now, I'm sitting. Good MET goal is about 500 MET minutes per week, which is like at the baseline. For getting a good workout, about 900 MET minutes is what is recommended. If you could go beyond that, you are ahead of the game. How do you calculate the MET minutes? So I have a table right here with very commonly indulged activities and their MET values. So if you know the MET value of the activity that you're doing, and then you don't know the duration of the activity in minutes, you just simply multiply the MET value with the minutes. So say, for example, I'm strolling in a park at a slow pace. The MET value is listed at 2, and I do that for 15 minutes. So my MET minutes per week or for that activity is 15 times 2, it's 30. So I have long ways to go to meet that 500 goal. Or I could be highly athletic and indulge in circuit training with minimal rest, and that's 8 MET minutes, and I will exercise for 30 minutes. So 30 times 8 is 240 MET minutes. So you could, if you want to really go technical, you could use this and go with the calculating and indulging in those activities. You can mix and match the activities that you want to do, so you are not really bored or tired of what you're doing. In addition to taking care of your physical health, it's also important to take care of the emotional health and consider other factors which are important in cancer prevention. Sleep is a very important factor in keeping ourselves steady and relaxed. Sleeping guidelines suggest that one should get about 7 to 8 hours of good sleep, deep sleep every night. Meditation helps achieve that rapid eye movement, or the deep sleep, the REM sleep as we call it, and helps us recover from the stresses of the day before. Also, our cells recover from when we sleep, and it is important that we maintain a routine in sleep. It is important that we sleep at a certain time every day. Not one day you sleep at 9 p.m., another time you sleep at midnight. You go party, you're like, oh, okay, I'm going to sleep at 12. And then you wake up whenever. It's going to disrupt your sleep pattern. So it is important to establish a good, relaxing routine before you go to bed. And yoga and meditation helps with that. Some people like to read holy books, that tends to relax them, or listening to soothing music, that helps them. So say, for example, you decide 10 o'clock is going to be your bedtime. So 9:30, you wrap up everything, you go set your room the way you want it to be. Some people like it warm, some people like it cold. And you go ahead and lie down. When you lie down, close your eyes, your brain's gonna be talking a million words to you about what happened during the day, what's gonna happen tomorrow, what am I gonna do tomorrow, all of that. Let it do it. After some time, it will slow down. And then you may still have about 15 minutes or so to get into your routine, to do your meditation or to relaxing music. It's a cumulative effect that's going to build and help you sleep better and deeper. And so when you wake up, it's going to help feel relaxed and you will be ready to do your exercise as well. Stress management is another important factor in staying physically fit. The stress increases the sympathetic activity, which can affect the sleep. It can also affect our daily activities in how we think. Yoga, meditation helps achieve harmony between the mind and body. When we are stressed out, there is extreme release of cortisol, which is the stress hormone, because of the way the stress affects the pituitary gland in our brain. That is also going to affect the estrogen, other hormones in the body. So indulging in relaxation strategies is also important in stress management. Last but not the least, I always enforce good posture and diaphragmatic breathing exercises to all my patients. And the posture is very important because if we are sitting like this, our diaphragm cannot hardly move there, and you're going to end up breathing very shallow. So we're not getting that oxygenation, which is required to keep the cells healthy. Also, we have our lymphatics in the body, which are responsible for the immune system. If you have a posture which is not good, then you're going to impede that flow, and it is going to affect your immune system. The yoga breathing practices and poses, all of that is going to help you maintain that good posture and achieve that diaphragmatic breathing. It is important to take charge of your physical and emotional well-being. And that is going to get us going longer and help us stay healthy. Any questions? I'm going to pass this to my colleague Ricardo, and he's going to talk about nutrition and cancer.
Hi, my name is Ricardo Lopez, and just like Chica said, I'm going to go over nutrition and cancer prevention. I want to start with this topic, maintaining a healthy weight. It's one of the most important things that we can do throughout life. There's a strong evidence that the more body fatness in the body increases the chances for different types of cancer, including breast cancer. This is also very important for postmenopausal women because the body in the adipose tissue is the primary location for estrogen production, just like Rushika was saying, of the benefits of exercising, reducing these estrogens. This score, it is measured by the weight and the height. The healthy, it is between 18.5 and 25 score. Over 25, it is considered overweight. And then over 30 is considered obese. Then we go after the 34.9 obesity type 2, and the more body fat increases, the more the risk for cancer occurrence. Because of the different body composition, if you have a score over 25, please reach out to your provider or also dietitian, because what we need also to consider the amount amount of muscle that your body has. A person may have about a BMI of 27 or 28, and maybe the reason of having too much muscle. The same for different type of people, different ethnicities, especially for Asian people. The BMI varies with them. So please reach out if you have any concerns, and also if you want to lower this score to healthy, again, score lower than 25. The second topic that I want to talk about is the importance of bringing enough vegetables and fruits into our diets. One thing that I recommend the most is to follow the approach of a plant-based diet. Why? Because it's going to bring a lot of fiber, antioxidants, and phytochemicals to our system. So these three are well known to fight diseases, including preventing cancer. One of the recommendations for vegetables is having 4 to 5 servings a day. Some of my patients may ask me, how can we reach this goal? If you want to measure this is converted into 2 cups a day of vegetables. Or if you want to bring these vegetables into the daily meals that we have, one of the most common tips that I tell them is to mix these vegetables with your protein. So let's say for breakfast, instead of having eggs and sausage, maybe we can have spinach and mushroom scrambled eggs, or we can have a vegetable omelette. We can have also some eggs and pico, or eggs and salsa. The same way the same way we can bring these vegetables with the proteins for lunch and dinner, which is typically more like if we're gonna cook some roasted chicken, we can add some veggies on the same pan, so we can have roasted vegetables with roasted chicken. Another tip that I give them is if we have vegetable soup and we know it's gonna last for 2-3 days, it's easy to pair any meal that we're gonna have throughout the day with the vegetable soup on the side, okay? And so on. These phytonutrients that we're gonna find in the vegetables, the function varies, depends on the color and type of vegetable. For people that don't eat vegetables at all, I sometimes ask them, do you like vegetables? And they often tell me yes, but the problem is that they don't eat it. And maybe one of the also things that I notice is like we go grocery shopping without being conscious. We just go because we just need food without realizing what food choices I'm bringing home to feed myself and to feed my family. So make more conscious shopping is one of the starters that we have to do to bring more vegetables into our diets. One goal that we can implement also for these people that eat low amount of vegetables is to try to eat at least one vegetable with a meal, okay? Going towards the goal of having half of the meal full of vegetables and fruits, and then the rest with your proteins and also carbohydrates. With the fruits, we have a goal of 3 to 3 servings a day, and same of vegetables. The type of phytonutrients on these fruits are going to depend on the color and also on the fruit. Tips to bring more fruits into our diets is to have fruits in between the meals. Also creating or preparing smoothies in the mornings with mixing vegetables and fruits like kale, bananas, ginger, almond milk. You blend it, and that could be your breakfast on the go. Fruits you can add also to your salads. Now, another question that I get from my patient is that, are frozen fruits and vegetables healthy? And I tell them, yes, they are very healthy. They are fresh cut, they're frozen, and they conserve and they preserve the antioxidants and the phytochemicals alive in a way. So when we eat them, it's just like eating a fresh produce. So yes, it is very healthy. Same for if you want to eat canned fruits and vegetables. We just need to look for the sodium content and the sugar content. But pretty much these will be amazing choices if we want to bring more fruits and vegetables into our daily lives. The next slide, I'm going to talk about beans and legumes, fruits, whole grains, and refined carbohydrates. So all of these are going to be carbohydrates. This is extremely important, same as fruits and vegetables, because having complex carbohydrates are going to be helpful to maintain a healthy body weight, okay? Now, the beans and legumes, I'm talking about all type of beans, pinto, black, lentils, fruits, whole fruits, like I was saying, whole grains like quinoa, couscous. In the terms of the bread, I also get a lot of questions. What type of bread should I get? Any brand that you want. If you get any special, the stores may carry for the day, as long as the package says whole grain or whole wheat. Those will be great options, and also for the sprouted grains. These three, the whole grains, the fruits, the beans, and legumes, are going to bring a lot of fiber into our diet. And the importance of diet is not only to have a good digestion, but also to boost the immune system by having a healthy flora in the gut. Now, with refined carbohydrates, it is a very predominant component in the Western diet, like donuts, like pancakes, white bread, white pasta, white rice, etc. Okay, and again, going back, making conscious shopping when we are at the store it's gonna help a lot, because having these choices at home, it may be more difficult to make a balanced meal. Okay, if we know that we have cookies in the pantry, it's very, the temptation is there, same as donuts or other refined carbohydrates. Also on these refined carbohydrates, I get a lot of questions. What are these refined carbohydrates? And I always tell them, if it's a process and it comes in a package, and if you look at the label and the ingredient list shows a long list, then it's refined. Then it is processed carbohydrate or processed food. We should leave it at a store or just have them occasionally. I don't want to say don't eat it ever or don't eat white pasta ever, but the less, the better for sure. Let's see. On the next slide, I'm going to talk about healthy fats. The importance of these healthy fats, because it is that some fats increases the cellular inflammation, and this is well known as cause for chronic diseases and also for cancer. So what fats can I choose, or should I choose? Healthy fats. One trick that I can give you, if the fat is coming from a plant like avocado, like all type of nuts, walnuts, peanuts, almonds, seeds are going to be healthy. And I'm going to include also the fish in here, because some fish are also high in fat, especially omega-3. Avocado oil, olive oil, and canola oil are going to be the best cooking oils that we want to have at home. Now, when we have fried foods, like fried potatoes, savory snacks foods, fast foods, chips, these are the fats that are going to cause cellular inflammation, and also we're going to increase the chances to have cardiovascular issues in the future. So try to limit this. Some others that we need to consider are salad dressings and mayonnaise. And then for the meats, the red meats are going to have saturated fats, and these are also going to have implications in the cardiovascular system and also in the inflammation at the cellular level. I suggest for people who eat red meats to have or to assign select 2 days a week, and let's say have Wednesdays and Sundays, and to allow themselves to have red meats. And by red meats, I'm saying beef, pork, and also lamb. And the rest of the week, we can have fish, we can have poultry, okay, more lean, select more lean animal proteins. This is the last one is very important because these processed meats, deli meats like sausage, breakfast links, bologna, pepperoni, most of them are going to have nitrates, and these nitrates are going to be increasing the chances for certain type of cancers. Not necessarily, we don't have much studies for breast cancer, but for colorectal cancer. If you want to have these meats, there's new products now that they, on the label, they announce nitrates free. They should be a better option for you. But just look out for it because these ones are going to be also very high in sodium content. These are some emerging topics. Studies are still, we still need more studies for these, but green tea appears to be a good beverage of choice for reducing risk for breast cancer, and also a good choice for breast cancer survivors. These studies shows that 2 to 4 cups a day are gonna inhibit the cancer growth or cancer cells growth, which is very very fascinating. Soy foods. Some people may be afraid of soy foods because some of the breast cancers are hormone receptors or hormone positive. So soy foods are gonna be helpful in some type of cancers. Research has shown us that consuming moderate amounts of soy food does not increase the risk of developing cancers, and in some cases even may lower it. Soy foods, I'm referring to soy milk, tempeh, tofu as well. And the last is going to be flax seeds. Evidence suggests that consuming 1 to 4 tablespoons of ground flax seeds daily appears to be safe and may contribute to lower the risk of breast and other types of cancer. It's easy to adjust or introduce this type of foods if we have these options at home. The flax seeds, one of the recommendations that I do is to adding these to your smoothies or to your salads as a strategy to increase this flaxseed. And this is going to be my last slide. Nutrition can be overwhelming to put it into slides or even to explain as abroad. But if you have any concerns of your nutrition status, please reach out to your provider or also, like I said, your registered dietitian, and we can help you personalize diet plan, especially if you are at high risk for breast cancer, and also if you have any other chronic disease present. Okay, so any questions are going to be welcome.
Okay, so we have the first question. It says, this is for me, it said that I mentioned about exercise lowering the levels of estrogen. So this particular attendee is postmenopausal and is concerned that is there anything to worry about making it too low, or do the benefits outweigh that? It's not going to go low. It's not going to fall down. it's going to keep it at a baseline, and in fact, it can even balance it. So like I mentioned, if you also engage in mind-body relaxation techniques or meditation, then that is going to help balance your hormones, and it will help combat the effects of hormonal imbalance. So there is no problems in exercising if you are postmenopausal. The second question is, if I've already been diagnosed, is it okay to keep exercising? Yes, definitely. Exercise, you can start at any point. It's just that if you have been diagnosed with any kind of GI cancers or colorectal cancers or anything that involves abdominal surgery, you should hold off on doing any kind of abdominal strengthening exercises or heavy weightlifting. You can always take an okay from your doctor, your referring provider, for you to start exercising. But simple walking at any point is going to be helpful. In fact, exercising, the cardio, and low-level strength training has also been shown to be effective in cancer-related fatigue. So if you are undergoing chemotherapy and you have fatigue related to that, or you have neuropathy associated with that, it's going to improve your circulation and give you energy to do your daily activities. There is a third question. Does a healthy weight on the BMI chart reduce the risk of breast cancers or all cancers? And
the answer is yes.
Yes.
Healthy weight reduces the risk for breast and other type of cancers. And the best approach to get a healthy weight, it's going to be the mixture of physical activity and also well-balanced diet. And again, the best approach that I recommend is plant-based diet. That doesn't necessarily mean avoiding animal sources or animal food sources, but be more mindful on the amount of meats that we're consuming and bringing more amount of fruits, vegetables, and whole grains as well.
this is for you, Ricardo. There is a question from an attendee. There is not a grocery store close to my house. Any tips about what I could do to eat healthier when it's hard to get fresh vegetables all the time?
Yes, food deserts is a common problem. I would recommend to have frozen fruits or vegetables. Those are you can mix it with your smoothies, or you can also cook them. Also, if you get canned fruits or canned vegetables, what you can do once you get home and ready to use, you can open the can and you can rinse your vegetables. And that way we reduce the amount of sodium in the can. There's also different types of fruits and vegetables products. So if you look at the ingredient list and check the label, just check the ones that have, or choose the ones that have the least amount of ingredients. If you're buying, let's say, beans in a can, and you look at the ingredients and it says only beans and salt, then it's going to be a great product. But if it's going to add unhealthy oils or more ingredients, additives that you are not going to be able to pronounce, typically those are going to not be the best choices. Mm-hmm.
Any other questions?
No more questions?
Okay.
All right, this is going to be the end of this presentation. Again, my name is Ricardo Lopez, and if you have further questions, don't hesitate to reach out to your provider or healthcare team for us to help you approaching and getting a healthier diet, or also to help you with your exercise goals.
We have some upcoming seminars during this week. If you did not attend the one, like Umber said earlier, the one that was that happened yesterday, you can go on the Parkland Hospital website and you can see that one. If you missed part of today's presentation, you can go there and see that as well. And then tomorrow, from 4 to 5:15, we have the screening and prevention for breast health. And on Thursday, there are facts about breast health. These both presentations are from our medical providers and the advanced nurse practitioners. And the breast cancer awareness symposium is this Saturday, October 24th, from 10 to 12:30 p.m. So hope you all can attend that and make the most benefit out of it.
Thank you.
Thank you.